absolutely, it's my pleasure to introduce you to Jarina Choudhury from NCVO's Volunteering Development Team as a consultant there. She provides guidance to the public, private and voluntary organisations on volunteering strategy, design and implementation of volunteering programmes. Wow, that was a mouthful there. But we're going to be talking today about how volunteer centres have been responding to the COVID-19 pandemic, so really, really topical, and the role that they have played working with mutual aid networks, supporting communities during the crisis. So without further ado, I'll hand over to Jarina, who's going to lead the afternoon for us. Thank you, Jarina.
Thank you, Rhiannon. Really lovely to be here with you. I'm a big fan of the Heritage Volunteering Group, I should say. I was invited to chair your national conference in 2018 at the National Museum of Wales in Cardiff. And I was invited back last year as well to chair the conference there in York at the National Railway Museum. And also this year, I was very excited about that. But then, you know, COVID came along and scuppered those plans. So, okay, so what I'm going to do is, actually, I have to say, since I discussed this session with William which was only last Thursday, I have changed things ever so slightly, but I'm sure that what I will cover will be relevant and useful to you. So please don't be alarmed, about the slight change. So I'm going to give you a quick overview of government guidance, just to make sure we're all on the same page. And then I'm just going to tell you about the COVID volunteering evidence group, which will be of interest to you as well. And then we're going to spend the majority of our time talking about returning volunteers safely and thinking about how those conversations can be framed, what we need to do, whether we have any guiding principles or we can pull those together through this, through the next half an hour, 35, 40 minutes. And then there'll be time as well for questions. And the section on returning volunteers safely will be more of a conversation. So I'll be very happy for you to put your thoughts, your agonies, your reflections in the chats box. We might not be able to conclude everything today, but I'm sure we will have a really worthwhile conversation about this because it is a big issue. And every organisation I've spoken to is scratching their head about this. So please don't feel alone on it. Okay, I hope that sounds good to you. And we'll stop for questions every now and then. So don't worry, I'm not going to gallivant through loads of material and you'll just feel like, oh, I didn't get a chance to ask anything. There'll be plenty of time for you to ask. Okay, so it'd be good if my computer worked now. There you go. That's what I just said we're going to cover. And yes, that's it, self-explanatory. Okay, so first of all then, let's just look at the government guidance. Now we know that the guidance hasn't been the most clearest and that it's taken some trawling through and interpretation as well to various settings. So I just want to make sure that we are all on the same page with where we are now as lockdown is eased further and is going to continue to ease over the next few weeks. Okay, so I think what I have here is guidance that came out sort of 4th of July onward. There were some updates on the 4th of July, also on the 6th of July, also on the 11th of July, and there's also going to be some more on the 24th and the 25th of July. So you can see it's a very gradual kind of loosening of restrictions as we're heading through the rest of the summer, basically. But I just wanted to be clear with you about this 2-meter rule, because I think when an announcement was made last month about social distancing, I think people were starting to get the impression that actually 1 meter was okay. Actually, it's not. It's still 1 meter. It's still 2 meters, and only 1 meter and a bit more, whatever you can manage, with precautions. And when guidance says with precautions, what it's telling you is basically it's telling you to wear a mask. It's not saying that explicitly, which I think is part of the confusion and what I said earlier about interpretation. We have to sit down and interpret this stuff, and it is important because if you're thinking about making an environment safe, which you have to do lawfully in order to bring your volunteers back, you also want to psychologically reassure them, and you want to make sure that they are also taking the steps that they need to on an individual level to safeguard themselves. So 2 households of any size can still meet indoors or outdoors, but again, social distancing applies. But those physical distancing rules haven't changed at all. So please do bear that in mind. Places of worship, you may have heard, they've opened. That's really great. But singing is not permitted. And I know that the Voluntary Arts Network made a submission to the government around some of its guidance and a lack of clarity around things like professional musicians as opposed to non-professional musicians, and government guidance just not being clear, lacking clarity, and making a kind of confusing distinction between those two, when actually voluntary arts were really great about saying you need to reissue your guidance and it really needs to take into consideration the things that we're telling you to include. Outdoor performing arts venues opened, I believe, on the 11th of July. But again, social distancing rules apply, and outdoor swimming pools have also opened as well. So things are gradually changing, but they could also, you know, revert back to quite a different situation. Maybe we can talk about some scenarios if that were to happen. So then let's just think about with effect from the 24th of July, masks will be mandatory in shops and supermarkets. Now, I have no idea whether this will be enforced or not. I know that as of about a month ago, it became law that you had to wear a mask or a type of face covering on public transport. I took a train journey in London for 15 minutes last Saturday because I had no choice. I absolutely had to do it. I hadn't been on public transport since NCVO closed the building on the 17th of March, when I had to go into the office to get my laptop and to get everything I needed. So I only went on the train on Saturday because I absolutely had no choice. And I noticed about half the people there just weren't wearing masks. So there will be fines for people, but then again, I don't know whether this will be, how heavily that will be enforced, or whether it's a kind of more of a kind of, shall I say, tokenistic kind of nod to, oh, we all have to be careful, but actually no real enforcement to back that up. And then with effect from the 25th of July, it's a busy weekend, this one, indoor gyms and indoor swimming pools are reopening. So all of those close proximity venues, which were considered very extremely high risk, restrictions are relaxing so that they can reopen. And then with effect from the 1st of August, the 2.2 million people who were asked to shield initially for 12 weeks, and then that got kind of extended along, they will be, shielding will temporarily be paused from the 1st of August. And I spoke to somebody about this from the NHS, and they said, well, we are kind of, we're not sure what will happen. So that's why we're very clear about temporary pausing rather than saying, right, okay, everything's fine, because I think we all know that coronavirus isn't going away anytime soon. So this means then that people can return to their place of work or volunteer if they cannot volunteer from home or work from home. So something to think about there when you're thinking about returning your volunteers and bringing them back. Okay, so this is a good thing that my ex-boss, who's now abandoned me and gone to the DCMS on secondment, Sean Delaney, you may know Sean. So he put this together, and I really like this because it summarized things very neatly. I think we all got very confused in the beginning. We were all scratching our heads saying, okay, well, what if you're self-isolating for these reasons? And anyway, basically there are 4 groups here. There are people who are clinically vulnerable. So they're people who are age 70 or above, people who might be expecting a baby, or somebody with an underlying health condition, or could be two of those situations. And then there's clinically extremely vulnerable, who are people with on a list of conditions which unfortunately predispose them to coronavirus, regardless of age. So you need to know, and you need to be aware of what that list is if you're going to think about bringing your volunteers back safely. And you also will be needing to ask them some questions about their health status as well. And then people could be self-isolating just because they're in perfectly good health, but they just have symptoms, but they're not in the clinically vulnerable group, or they're not in the clinically extremely vulnerable group. So I think, and then there's everyone else who doesn't need to do anything. So they're sort of, free to volunteer or not, as they wish. So there's a Twitter link there, if you can see at the bottom there. And Sean actually put together quite a good Twitter thread, about 9 posts, that was kind of laying out all of this, which is still up to date and correct. So you can just, when I send these slides around, you can just click on that and you can get a breakdown if that's helpful for you. Okay, let's move on now. I want to now tell you very quickly about the COVID Volunteering Evidence Group. So this group is a partnership between NCVO, the Institute for Volunteering Research, the Voluntary Sector Studies Network, which is part of the University of Birmingham, and also the Third Sector Research Centre, which is always a tongue twister for me. I end up saying something else. So what they're doing is they're doing a kind of evidence review. They're looking at how organisations have responded to the pandemic so far. They're going to be looking at volunteering patterns. And I was just saying to Vanessa that the NCVO Civil Society Almanac, which uses data from the Community Life Survey and also other sector data, was launched last week. It's on the NCVO website. That came out on the 8th of July, 2 weeks ago. 2 weeks ago, yeah. But actually, a lot of the data in there is pre-COVID data, because all the COVID stuff started happening from March. So the Volunteering Evidence Group will be looking at how the pandemic has affected volunteering, and there are 4 partners involved in that. It will be very, very exciting for you to get involved in this. They are also drawing on other surveys, sector surveys, and surveys that have taken place in the last few years, like Time Well Spent, which I'm sure you know about. If you click on this link, you can find out how to get involved here, because they are doing regular updates. And NCVO will be blogging and talking about releasing, you know, the findings and debating this with you. And I'm sure somebody from any one of those 4 organisations will be happy to come to one of your masterclasses and perhaps kind of give an overview in the next month or so, when we've got some findings out of the group. So it'll be really interesting, because it's all about coronavirus impacting volunteering. Okay, so any questions at that point? I think it's probably good if we just pause for a second there. Any questions there?
So we've had lots of comments so far, Jarina.
Right.
But not huge numbers of questions so far. Comments about how to stop face masks from steaming up. But I think, yes, I think you've given lots of information so far, so there aren't any questions. Does anyone have anything burning that they'd like to ask at this point? No. So should we carry on? Oh, Alex.
Let's carry on. Yeah, because then we can really get into the meat of the next, we can have a good 20 minutes or so on the returning your volunteers.
Perfect.
Okay.
Carry on now then.
Thanks, Rhiannon. Okay, so returning to volunteers safely. Now, I want to tell you something here to give you a bit of reassurance. Well, I hope it gives you some reassurance, but I'm not sure that it will. You're not going to find one definitive guide that's going to help you to do this, I'm afraid. You're going to have to beg, borrow, and steal in the creative way that I know only you can. Using all your kind of emotional resources and ingenuity with this. You're probably best placed to do this, because I think that volunteer managers are a bit more, in touch with their sort of emotionally intelligent side, and caring about welfare of volunteers and well-being of volunteers. So I think you're probably better placed to do this than maybe other people would, but it will require you kind of pulling in lots of materials. And I've got some. I've done a slide for you at the end. I've hunted the internet. I've found some things for you, but you're not going to find one thing all in one place. I'm sorry to tell you that. Okay, so what I want to do now is I want to have a chat with you. I said to William, I want to have a chat with them. And I want to have, I want to ask you these questions. I want to spend a few minutes on each of these questions. So let me just read them out to you in case for any reason somebody's not reading them out. I'll read them out to you. So what do you need to consider when inviting volunteers to return? What things, you might find this a helpful question even if you problematize it for yourself and you think, well, what am I worried about? What am I, where are my kind of fears in this? what are you thinking about in terms of outcomes? Where do you think a conversation could go with your volunteers? And we're going to plot those today. We're going to agree how, there's really only a few, 3 possible outcomes that I can think of. I don't know, maybe you can think of more. Can you align with any existing principles? So for example, I saw, and I've included it, the Canal and River Trust. They've got a COVID risk assessment, and they have something like 7 guiding principles that kind of that their risk assessment is sitting on. So have you got any existing principles or organizational principles? I'm sure you do, I bet you do. And then could you couch this piece of work within those principles? Think about what is the best and most feasible method of communication with volunteers about this, because these are delicate conversations. I had an email this week from a very frustrated man who's above the age of 70, who's been volunteering for the National Trust, and he's really upset because they've told him that he can't volunteer, and he's come to us saying, can't NCVO put out a kind of position statement to encourage organisations not to prevent people from volunteering? So I have yet to get back to him about that, but I was very touched to read his email. Okay, so what's manageable? Because there's no point in you thinking you're going to have, 50 or 100 one-to-one conversations if you know you can't do that. Now, some of these conversations could be quite involved, so you really need to think about how can you this process of trying to discern and come to a good positive conclusion for volunteers around returning, or perhaps not returning, or perhaps something else. How can you, think about the communication methods. And also, we know about digital divide. We know not everyone's on Zoom, not everyone's, even got a smartphone. So how are we going to get around that? How can we work with the best way that people, the most suitable, appropriate way for them to be communicated with? And what information resources do you currently have? Now, I saw on the HVG website, you have got a couple of resources already. I had a little look there. But I mean, you almost want to do an audit of what resources do you have in terms of policies, organizational policies and documents to help you do this? What can you see from the NCVO website, or wherever, whatever's helpful to you? What can you learn from other sectors? What can you borrow? I've seen some interesting things coming out of the NHS in terms of returning their volunteers. So yeah, this is what I mean about, be really unorthodox, just beg, borrow and steal to kind of put this all together, yeah? So what other information resources do you need after you've done your little audit? What's missing? And then how will you communicate outcomes of decisions to volunteers? So again, the sensitive conversation, or it might not be, but yeah, how to handle that, with care. So I'm just wondering, how, going back to that first question then, I'd love to know, what's in your mind? What are you thinking about when you're inviting people back to volunteer? And you might want to think about things like, you might say, well, actually, there's no role for them to come back to. If that's one, tell us. You might say, I'm really fearful about getting into really difficult conversations and getting into arguments. Tell us. If that's another thing. Think about, anyway, I think I've said enough there. I don't want to keep talking, otherwise you won't get a chance to ask questions or share your thoughts. So what's in the chat box, Rhiannon? I'm waiting with anticipation.
Absolutely. So Rich has mentioned that museum development have got some good examples of processes. Do you want to say a little bit more, Rich, about what you see are the positives about their input?
Yeah, they seem to have taken quite a holistic view about all the various areas that you need to bear in mind when returning volunteers, returning staff, and getting ready to reopen. So it talks about marketing, it talks about messages, it talks about volunteers, it talks about staff. There's a lot of really good examples there. The link in the chat for people to look at. And sometimes I think it's useful to actually see it written down in a format other than just a bare template for you to fill in. You just think, am I getting this right? With so many people on furlough, I found it very difficult to reach out to see if anybody's in to say, is this correct? And I've got good long history of writing risk assessments professionally, and even I found it a struggle to really get to grips with some of the things that we're being asked to do. And I've also had templates from local authorities which have been dreadful, really, really poor. Yes, I'd look to the people you trust, your museum development teams, to provide some of that.
Yeah.
Great,
Brilliant.
thank you, Rich. And Rich has included a link actually in the chat as well, so you can access some of those. There's been quite an interesting debate actually on the chat about age, so that national trust comment that you made, Jarina, about whether actually that's legally correct, or and how we should do that. Do you want to say any more? And I know that comment about that. Ruth, do you want to sort of say any more about your comment?
Yeah, so at the Ashmolean we've, well, I've had conversations with volunteers who are over 70 who want to come back and are really keen to come back to volunteering. And yeah, my understanding is that we shouldn't be and can't legally discriminate against people based on their age or their health, so that as long as we're really clear about what the risks are and share any, thorough risk assessments with them and go through the roles exactly, that we shouldn't be discriminating against them based on that.
I'm really sorry, somebody's knocking on my door. Do you mind if I just answer the door? I'm really sorry, just bear with me. I'm quite near the door, so don't worry. I'm going to come back.
Absolutely, and it's an interesting point that you make, Ruth. So I, at ZSL, London and Whipsnade zoos have now been open for a month and a bit now, and I would say that the backbone of our volunteering team are over 70s. If anyone doesn't know, Whipsnade in Bedfordshire is actually a huge site, and a number of our over 70 volunteers are much fitter than myself in my mid-30s. So I totally agree that it needs to be done on an individual basis, around actually the role, what's expected of them in the role, where they'd expect to be working in that role, and any adjustments that you can make to that role. We have one volunteer who's quite specialist. He analyses the reed beds for health. He comes in, signs in, picks up a radio and spends his time in the reed beds. It's a perfect socially isolated volunteer role for someone 70 plus. So to assume a blanket no wouldn't be very supportive of him or the organisation, in fact. But Jarina, do you want to say anything else on that age factor?
Yeah, I do actually. The Equality Act doesn't actually apply. I know this is very perverse, but the Equality Act doesn't apply to volunteers. But of course, it would be insane to treat volunteers differently to how you would treat, a member of staff in that respect. So we absolutely don't encourage a kind of blanket saying to people, well, just because you're this age. And it's very ageist to do that. I mean, it reveals, I don't know if you remember the report, the Commission on Voluntary Sector and Ageing, which came out in 2015, but it's still a really excellent report and is available on the internet if you just Google it. And it just reveals all the kind of prejudices and attitudes that organisations have, unfortunately volunteering organisations have, towards people about age. And I don't just mean older age as well, I also mean young people. So yeah, I really wouldn't encourage that way of all you will do is create a terribly bad atmosphere, and it could be a risk for you in terms of your reputation if you start kind of dismissing out of hand people just based on on their age. And you're right, I mean, it depends very much on their own health circumstances. They could be much younger but have an underlying health condition which could predispose them, such as this clinically extremely vulnerable group which we mentioned earlier. So I think you need to really think about getting people to kind of almost self-assess. And I know some organizations are doing this. They're also doing it because not only does it prompt the conversation with the volunteer, you're starting from a place where the volunteer has given you this information about them. So it's not as if you've had to you've set the ask in terms of, we'd love you to come back to volunteer. However, because of coronavirus, we do need you to answer some questions about your health. And then if they're answering these questions, then you can use that as the basis of your conversation and the basis of your risk assessment, because you have from their own words their own assessment of how they think they are, how well they are, or their general health condition. I also think that to not only, there are three things really, as I think some people have already pointed out. There's an individual's own health condition, but there's also the role. What is the role? What are people volunteering to do? What are the risks associated with that role? And the volunteers' environment, where are they carrying that role out? If you are in a socially distanced garden and there's no one else around, sounds like heaven, really. It's a completely different setup to, if you're in a space where, actually, I had an example of Citizens Advice and their witness service, and when they were thinking about this, returning volunteers and having conversations. So they have volunteers that accompany people on cases. So it is the witness service. Often people don't want to give evidence because they're afraid. So if they've got a volunteer with them who's trained and can accompany them to court or to tribunals, then they'll be more empowered to actually give their evidence. But lots of courts are antiquated. You can't, buildings where there isn't necessarily much space. If you're in a courtroom, I've never really seen a socially distanced courtroom apart from where where perhaps a magistrate is, and compared to the jury. So they had to think about that. They had to think about how much control did they have over their partners as well, their partner organisations that are helping to recruit volunteers for witness service. And then going off to these environments where perhaps it's not as if it's your own building or your own premises where you have control over how you might plan for making that COVID secure. So any more questions then coming through or comments?
Yes, so there's a good question from Alex, which you might have something to say on. Alex, do you want to ask your question?
Yeah, so I was just wondering about people that have had their volunteers back already, whether they had individual risk assessments. So we've all done risk assessments for the roles in the past, but they have changed now, and whether people have actually created their own risk assessments individually, and whether people have got examples that might be able to share within the group.
Yeah, I think I'd probably be able to get you some examples. I don't have any to hand. I think people are still finding their way through this process of having those conversations of returning volunteers, Alex. And I really don't think that most organisations are way down the line with this. I think there's also a reticence because people are fearful that actually the situation might change, or that we're going to head into a situation of regional lockdowns, as we saw recently with Leicester. So I think that because people are struggling with how to do this and how to do this fairly, there aren't any examples that I know of at the moment, but I'm sure there will be in a few weeks. And I know that the NHS they're further down the line with their discussions, because their volunteers are working in very high risk environments on hospital wards and so on, clinical settings. So I will be able to get you some examples, and I can share that with the steering group.
Yeah, that's great. The question I wanted to ask was linking into different roles that volunteers do. A lot of volunteers that used to supervise with activities, events, handling tables, all of that is temporarily suspended. So it's about sort of working with them to see whether they just want to be a welcoming face in the gallery, like what some of our visitor volunteers have done, or whether it is just that they have that time to have more of a break, or some of them have said they don't wish to come back as well.
Yeah, and I think that's a good point. Being prepared for different outcomes. We might think that this conversation is going to be really difficult and somebody's going to insist that they want to volunteer, and actually they might have changed their mind over the last sort of you know, I don't know, however many weeks we've been in this situation, 4 months. If there isn't a role for them to come back to, and if you can't create a role for them to take on that they would be happy to do or happy to try, I really wouldn't push it. There are other things you might want to do to keep them engaged, you know, rather than just kind of end the relationship there, especially if they've been volunteering with you for a long time and it's important to them. There might be other things you can do. I mean, I don't know, could you set up an alumni? Could you, you know, is there a way to use social media to kind of have like Twitter chats with them every now and then? If they're not on Twitter, I appreciate not everyone is on social media. What are, you know, are there other things? I know of organizations that have been running like massive Zoom meetings with their volunteers just to keep them engaged, just to have with them. I mean, you know, like a coffee like this, but you know, with
I mean, I suggested quite a few things more engaging around Volunteers Week, but our senior management's decision was to actually have it more of a distance because they hadn't made the decision about when they were to come back. So it was like, we still keep them updated with emails, but they didn't want me actually to do any more sort of like interaction during the lockdown period.
Yeah. Okay. Right. Thanks.
Thanks.
Any more questions, Rhiannon?
There's a lot of conversation around the benefits of individual risk assessments versus role risk assessments or organisational risk assessments. And there's quite a lot of comments about kind of which you should go to. In my organisation, what we did, because zoos were quite quick to open compared to other heritage sites, we issued risk assessments for the sites in general. We've been risk assessing individual moderately levelled volunteers coming back, and now we are risk assessing the roles once they've been in operation for a little bit, because actually on day one it was hard to tell what the role would slowly evolve to look like. So a bit of a combination of what you've been saying as well, Jarina. I think, to be honest, that's it. Maybe if we move on and we can take some more general questions towards the end.
Yeah, sure. Okay, let's move on. Absolutely. Okay, so I'm just going to share with you some resources then. We've got another 5 minutes or so. This is actually timed very well, very, very well. I just want to share with you. So this is what we have. We've updated everything on here. We've kept everything very well up to date. Yeah, I mean, it's self-explanatory. There's quite a lot of good stuff here, actually, under supporting staff, volunteers and beneficiaries regarding returning. So I'd spend a bit of time looking there. I think many of you have probably, you know, seen all this stuff. It's been up here for a while, but we have updated it as well. There's not a terribly amount of new stuff here. A lot of the new stuff is actually sitting under supporting staff, volunteers and beneficiaries. Now, this is where I was like mining the internet, looking for things, and I've really got a mishmash of things here for you. We've got the standard health and safety risk assessment template, which I'm sure Richard will say, that's very dry. And then I actually looked at things like, I was going after medical organisations because I was thinking they're the people that are going to be, I mean, you know, I just think more advanced in terms of, you know, asking critical questions about well-being. And that BMA risk assessment is really good, actually. I would spend a bit of time looking at that. And then the Institution for Occupational Health and Safety, again, I mean, it's got some good principles in it that you might want to think of. I mentioned Canal and River Trust. Sport England have produced their Return to Play, volunteering, guidance. Volunteering Matters have a few resources around, building reoccupation and general risk assessment. And then I found something interesting on NHS employers. I found they've got some well-being coaching questions as well, and a template to accompany that. So have a look at those, because you can adapt them and you can kind of choose the best bits as you wish. And then, just a list of our blogs, all the up-to-date blogs. The July roundup is coming out next week as well. So that will be on the website. And then we've done a series of webinars as well. So I pulled out the ones that I think are most pertinent for you, that are, you know, returning to volunteering and to places of work. I did one last week, which was a kind of a summary of the National Volunteering Forum, which took place on the 18th of June. And we did quite an interesting retrospective in the morning, looking back at what organisations had learned. So there were 4 organisations there. And yeah, one volunteer centre, one mutual aid group. So this is what I was talking to William about, and then I kind of changed it because I thought they can just watch the webinar, and then we can use this time for something else. And NHS responders, and also the voluntary sector emergencies partnership, which I think everybody should sort of be familiar with. And then there were other more kind of case studies throughout the day from organisations who are in those conversations now with returning volunteers, and also sharing some of their innovations. Sorry, dog is barking. Innovations around how the pandemic has really kind of given birth to lots of new ideas. So the amount of online volunteering that's been going on, because we haven't been able to physically be with one another, has been phenomenal. And, you know, micro volunteering, we've talked about this for years, you know, in the sector, and we were all scratching our heads going, yeah, one day we'll get around to that. Well, we have now, and you should watch the webinar. And then there are other webinars there that I pulled out, as I said, pertinent webinars. And you can go to the YouTube channel, you can watch all of them if you like. And then there's one coming up on the 23rd of July, which is, the booking link is there in that hyperlink, how to manage operational change in a time of uncertainty. So that's a free webinar if you want to jump on that. Any questions? Sorry, talk so much.
Great. Do you want to stop sharing your screen, Jarina, and then people can see themselves if they'd like to?
Yes, that would be nice, please.
Oh, brilliant. Hi, everyone. So we've got some good questions coming through. There's a question from Vanessa representing those on furlough. Do you want to ask yours, Vanessa? And then we'll go to Wendy. Vanessa?
Sorry, couldn't get off mute. My finger, the keypad got stuck. Yeah, it's really about the fact that there's quite a few people that are on furlough at the moment, myself being one of them. I'm very aware that a lot of our organisations are making decisions about health and safety already without maybe the, sort of sharing advice with volunteer managers because they're not in place. And I think, from my perspective, it was just really a question to everybody else as well if anybody got concerns. But I think from my perspective, what are the things that you think that an organisation that's thinking about health and safety in general, but maybe doesn't always see the big picture with volunteers as well, the things that we should be focusing on for volunteers that we can, when we do come back off of furlough, make sure that we've covered? What would you think would be those options, Jarina, that we should be thinking about?
I think it's a very difficult time, Vanessa. I've already seen in various trade press today online, some of the very large charities are going to be making lots of posts redundant. I always think volunteering is vulnerable. It's just like learning and development. It's always the first thing to go whenever there's a squeeze on. I think that if there's any way, even if you're on furlough, that you can kind of engage with volunteering. I mean, you can work now, can't you? You can go back part-time from the 1st of August or July. I'm not up to date on the furlough rules. I only kind of kept up to date with them up until the end of June. But I think if there's any way in which you can kind of influence some of the decisions that are being made around volunteer well-being and how to, just how to influence that, I think you should. It's just going to be a very difficult time. I know that AVM have put together a kind of call to action with other strategic networks, and I'm sure that Heritage Volunteering Group have probably signed up or will be asked to sign up to this, around kind of really thinking twice and protecting volunteering in organisations when those hard decisions are going to come. Some of them are already being made, unfortunately. But I just think it's going to be a very difficult time. I think if as a sector we can kind of shout as loudly as possible, because volunteers, we have proved, I mean, it's kind of self-proven, hasn't it? Volunteers have really kind of come into their own. You know, there's this has been the time when volunteers have been most needed. So if in order to make sure that they're supported going forward, and that we're not just going to lose this momentum, people just go back to work and how things were before, then volunteer management needs to be in place and needs to be preserved.
Thank you.
Thank you. So we're running just a little bit over, but I really want to get to Wendy's question. So if you do need to head off, thank you ever so much. We're just going to take Wendy as the last question, and we will save the chat because there's loads of good tips and references in there as well for people. So Wendy, do you want to ask your last question for us? You'll need to unmute yourself.
Sorry, it helps. You're slightly off on a tangent, but I'm a trustee as well as a manager with a different organisation. So I was just really interested. There's a little bit of a conflict with being a trustee in terms of the financial pressures that the organisation is open, and this need to get the doors open and get visitors, etc., back into the building. But at the same time wanting to be safe for everybody. And I know there are resources in some of the ones, Jarina, you've just shared, webinars, etc. But it was just any particular insights or thoughts on as a trustee the best sort of tack to take.
I think your number one priority is although you're volunteering, you are a trustee. So your responsibility for the organisation and your accountability to the organisation is probably the critical thing. I should probably, I'm working with somebody called Dan Francis, who is a governance consultant. I mean, he's a full-time staff member like me at NCVO, but I think it's probably worth having a chat with him. I really don't know about trusteeship. It's an area of volunteering that I am ignorant of. I have been a trustee a couple of times, but in terms of this situation, I definitely think it's worth taking your question to him if that's okay with you, Wendy.
Yeah, no, that would be
qualified to try to begin to answer. But as I said, I mean, I know Dan would say that your first priority is, being accountable for the governance of the organisation.
Yes, thank you.
Lovely. Okay, so we are running a little bit over, I'm afraid, so I am going to draw us to a close there. I know one last question's come in, so we'll try and answer that for you remotely and send the answers out. But a huge thank you to Jarina for your presentation today and sharing all your insights.